Hi everyone, this is Dr. Ginger Garner here, and I want to bend your ear for a second about how to get the most out of your diagnostic hip injection, an intra-articular diagnostic injection. It's not exactly a walk in the park, but it doesn't hurt that bad. The incision, the injection site, not the incision, is usually going to be, I'm going to show you my hip here. So if this is the ASIS, the bony part that sticks out, if you've had a hip scope before, your scars are going to be right in this area. The injection site's going to be just below that here, okay? And it's going to come up here to hit the hip and pop through that capsule. So to get the most out of it, there's about 10 points that I want to make for you. Sorry about the shaky camera, but I need to show you some things, and that requires me to move. The first little piece is going to be not my anti-COVID hand sanitizer, but my skeleton here. Because they're getting inside of the capsule to try and help determine if there is in fact an intra-articular issue, and that's the point of a diagnostic injection. The psoas, your hip flexor, I talk about snarky psoas a lot. The snarky psoas is going to come off of your lumbar vertebrae, through the abdominal cavity, over the ridge of the pelvis here, the pubic ramus, and right over the top of the labrum. Our good friend, the labrum. So when the psoas comes across the front of the joint here, you can have issues. And so this is what happens. Now I'm going to get still with my camera a bit here. When you get this injection, okay, coming up, big long needle, right? For those of you who have had it, if you haven't, you have something to look forward to. It can really irritate the TFL because it's going to go through the tensor fasciae lata, which is here. If you stand and you turn your leg in, you'll feel a muscle pop. And that's your TFL right here. It's going to come through the TFL, and it could irritate the psoas, which tends to be snarky already with intra-articular hip issues, meaning impingement or a labral tear. So to get the most out of that diagnostic injection, here are some pointers that your surgeon may not have time to go through with you on all of these, or you may not remember all of them, right? Because a lot gets said during those short appointments. The first is to remember that the psoas goes right over the top of the labrum. So first, no stretching your psoas, please. No runner stretches, no deep lunging stretches. If you are trying to take the stress off and the pain away from the inside of that hip joint, you stretching out your psoas is going to make it worse. So, as we say in the South, knock it off. No stretching the psoas, please, or that TFL, around the first week or so. I am personally, as a hip specialist, pelvic pain specialist, I'm not a fan of stretching the psoas, really under any conditions. So I'm going to show you a way to get around that. But because of that intimate relationship, that's the first thing I would say. The second thing, don't go hard at your exercise because you begin to feel better quite often with a diagnostic injection. That's not always the case with everyone. I'm going to mention that in a few minutes too. But because you will often feel better with a diagnostic injection, people tend to go hard. I'm going to go take that 5-mile run. I'm going to go take that 20-mile bike ride. I'm going to sign up for that triathlon. Post-diagnostic injection or any steroid injection, that is not the time to go big or go home or to go hard. You need to back off of the harder activities that you would usually do, even if you're feeling better, because you don't want to create more damage in the hip by pushing through and not feeling it. So think about your activity in terms of shorter spurts, a shorter walk. I wouldn't necessarily be a big proponent of jogging and running during this time either. Take a swim, but I don't want you to do a freestyle kick. I want you to consider, now I'm not telling you this is a prescription for PT, this is a consideration, to do like a mermaid kick, okay? You're kicking like a mermaid with both of your legs together, just like this. that might help protect that artificial stretch of the psoas that a freestyle kick would give you. So don't think that just because you're getting in the pool that all bets are off and you can go hard and do any kick that you want. Not true, unfortunately. So you have to take that into consideration. Those of you who work on Pilates reformers, that's a great way to unload the hip for the next 4 weeks after your injection. However, Joseph Pilates really depended on the psoas a lot. So think of things like the 100, where your legs are out in front of you and you're holding them. Not a good idea. So you want to eliminate all of those activities that would really depend on the psoas. Think picking the weight of the leg up, because that's only going to make it worse for a little while. The next thing that you may need to consider is your gait. So I'm going to back up here. When you're walking, so if my right hip is the issue, for example, when you're walking, you can take a normal step forward, but when this leg comes through, you may not be able to extend the right leg back like you could your left. So when I step through on my left, see how far my left leg can go back? And then I step through, right? Normal stride length like this. Instead, if your right side is the issue, when you take that step, you're probably gonna have to do more of like a step 2. So you won't actually step all the way through and force this leg to go all the way back, because it's going to stretch the psoas over the labrum again, and you may have an increase in pain instead of the intended effect of the diagnostic injection, which is to decrease your pain and inflammation. So keep the psoas off of that labrum. So I hope that makes sense. As you take that step, you're just not going to extend the affected leg back as far, and that should help ease the pain, especially for those of you who have flares after an injection, and that's not uncommon. It tends to make the pain worse instead of better, especially for the first few days. You're just going to take a shorter step length. Take that into consideration. Now, when it comes to sleep posturing, bear with me, I'm going to turn my camera here. With your sleep posturing, you're going to want to keep the hip in an open, packed joint position. Closed packed is this, trying to lay flat. The joint capsule is tight and wound. That's not going to allow you to sleep, because as they inject through, they make the injection inside the capsule, they have to pop through the capsule. And that can sometimes create some local inflammation. You don't want to irritate the capsule anymore. So you're going to help the leg up and over, and you'll sleep like this, with that leg propped up and slightly out to the side. That may be the way you have to sleep all night, because you're not necessarily going to be able to sleep on the affected side. So if my right side's the affected side, weight bearing on that side is probably not going to work that well. If you want to rest on your left side, what you do is you'll have one pillow here, and then you'll have another pillow where you can just pull a pillow up between your knees, but it needs to be very firm. If the knees drop together, that's only going to create pain. So you have to have a sturdy enough pillow where if I'm resting flat, my knee never drops below this level. That's your next consideration, okay? I know I have 10 considerations, but I'm not counting them out directly with each one. So let me roll myself back around here again. All right, so remember when I mentioned don't go hard on exercise? I don't think that your surgeon wants you to quit exercising either, because that's no good for nutrition of the joint. In order to get stronger and be better, we need to lift the weight and do the work. So you can't just mic drop exercise. You have to do exercise, but in a modified way. Now, usually if you're getting a diagnostic injection, your surgeon is typically going to recommend that you go see a hip and pelvic PT specialist. And I hope that you can find that. If you cannot, please reach out at drgingergarner.com. I will try to help you find a hip specialist. If you're in a state where I can practice telehealth, I will be happy to see you as a patient. I do have patients fly in from all over the country, so to the best of my ability, I'll fit you in my schedule if you want to come for a personal visit. But I will help you find someone nearby that specializes in both the hip and in pelvic PT. Because they need to be monitoring your exercise. They need to be specifically prescribing things that will unload stress off the hip and make, this is oversimplification, but make this stronger and take the weight and the load off of this. Because quite often in the pelvis, what happens, back to our trusty pelvis over here, is that the femoral head ends up too far forward in the joint and not centered, right, on the joint. So it ends up too far forward this way. That's an anterior shear. That's not something that your hip is going to like long term. And so a good hip and pelvic PT is not just going to say, stretch your psoas, do a runner stretch, and strengthen your glutes and then send you home. That is not what you should be getting in PT. So these videos are to help empower you to know what you should be getting and what you shouldn't be doing in PT, to help you find, the best surgeons, to help you maximize that positive potential of the surgery, to help you maximize the positive impact of a diagnostic injection that your surgeon has, with you decided was the best course of action. So I want you to be able to get the best care possible. Of course, I can't prescribe PT through a video, of course, but I can tell you what to look out for. And that's what the point is, essentially. Now, there's a couple of other things that I wanted to mention, and I need to get down on the floor to show you these. So bear with me. We're going down. All right, down to the floor here. Give me just a second to roll out a mat. Always have a trusty yoga mat around, or something that allows you to not have to be on the floor. There's two things that I want to point out here. Now, I have other videos on YouTube that talk about the side sit Sphinx, and it uses a ball that's a 6-inch ball, but I want to leave it squishy, don't make it hard. So I'm not going to show you that video entirely because this video is getting a little bit long, but I want to show you the premise. The premise is you're going to side sit and you're going to put the ball over that part of the psoas. Remember where I told you early on? It'll go over that part of the psoas, not over the belly button. And then you're going to rest over that and practice deep AD breathing. So I want you to look up the AD breath video, and then I want you to look up the side sit Sphinx video. That may be able to help you release the snarky psoas enough to get some relief, because it will feel like everything's tightening up through the groin and through the belly. All right, so a little suggestion, consideration there. The second thing is before you do a TheraBand roller, I want you to skin roll lightly around the injection site. It's going to be very sore, okay? So you want to lightly skin roll, just bring some nutrition and circulation to that area. You'll see what I'm doing through my pants here. So I'm kind of picking up the fat and the skin, right, over the muscle and rolling it around. You're also picking up the fascia. After you do that and you're rolling, skin rolling is, take 2 or 3 minutes to do that. Then you can lightly, not heavily, take your Thera roller. This is not an endorsement of a TheraBand roller, but they do work pretty well. No kickbacks for that, by the way. You're gonna roll that out, spend a few minutes doing that. Sometimes that helps. And then you can also look up another video, go to the hip, basically the post-op hip arthroscopy series. You'll find a bunch of tricks and tips and hacks there. The last one is putting the same ball under with your thumbs here. There's a video that's longer in the series that allows you to teach yourself how to do a bridge, but without your psoas coming on, because I don't want you to use your psoas. And you're just barely unweighting the ball and back down over and over again until that hip back here is really, you feel the glutes and the deeper muscles of the hip lock come on, but without your psoas. So I want you to look up, if you haven't seen any of those videos yet, again, in order to help you maximize the effectiveness of the injection, to get the most out of it, and to also preserve the hip joint at the same time, because injections can lead to damage if you don't treat your hip properly after you get one. So go and look up the hip hacks that will help you turn down that snarky psoas and turn on everything in what we call kind of the posterior chain back here. So I hope these 10 tips will help you maximize the effectiveness of that injection, get the most out of it, and maximize protection of your hip at the same time. All right, until next time, take care of yourself. Bye-bye.